I want to talk to you about something we get asked about every day in the office, and that is epidural steroid injections for back pain. I'm Dr. Casey Bearden with Action Spine and Joint right here in Nashville. A lot of patients come into our office after being told this is their next step, especially if they're dealing with things like herniated disc, sciatica, or chronic lower back pain. And on the surface, it sounds like a good idea. Inject medication directly into the spine, reduce the inflammation, and relieve pain. But here's what you really need to understand. Epidural steroid injections do not fix the actual problem. An epidural steroid is designed to temporarily reduce inflammation around the nerve root, and that's great when it works. The problem is, it only works half the time. And when it does, it typically wears off in a month or two, and the original problem is still there, and in many cases, much worse. In addition, epidural steroids have never been FDA approved for back pain. They are used purely off the shelf, so it's really just a shot in the dark in most cases. What epidural steroids do not do is they don't repair a damaged disc. They don't correct spinal misalignment that caused the problem to begin with. They don't restore normal motion. And they don't remove the mechanical pressure, only the chemical pressure off of the nerve. So what often happens? The pain may improve for a short period of time and then it all comes back. That's why many patients end up getting multiple injections over time, and there are risks to consider. Repeated steroids oftentimes will lead to weakening of the surrounding tissues, decreased healing response, and in some cases, accelerated degeneration of the spine long term. The reward simply isn't worth the risk in most cases. At Action Spine and Joint, we take a different approach. We focus on non-invasive treatments that address the root cause of the problem, not just the symptoms. That includes therapies designed to reduce pressure on the spine, improve the disc health, restore proper movement and alignment, and help the body heal naturally and, most importantly, long term. Now, every case is different, and there are situations where injections may be considered. But in many cases, they should not only be the first option or even the second or third option. You owe it to yourself to explore safe, evidence-based, conservative treatments first before going down the road of painful injections or dangerous surgeries. So call us today at 615-356-4656 or simply click below at actionspineandjoint.com to book your appointment online.